The acting head of media and communications. So we're extremely pleased to have Mrs. Graça Machel, a long-time Gavi advocate and a friend of Gavi's, with us. We have the Tanzanian Health Minister, Dr. Ali Minwi. Thank you for joining us. Gavi Board Chair Dagfin Hoybraten, who's just been re-elected for another 2 years as the Gavi Board Chair. We have our friend Dr. Flavia Bastrea from the World Health Organization, and Geeta Rao Gupta from UNICEF, another key Gavi ally, and CEO of Gavi Alliance, Dr. Seth Berkley. So without further ado, I'm going to hand over to the Gavi Board Chair, Dagfin Hoybraten.
Thank you very much, Dan, and welcome to all of you, friends of Gavi in the panel, and colleagues and friends and journalists, media people, welcome. This Partners Forum is a display of an alliance at work. It's a display of the diversity and the strength of the alliance that was put together in order to do something about the very unfair fact that access to immunization is dependent on where you are born. We think that every child deserves and has a right to a fair and healthy start in life. And that's why we have, over the last 12 years, come together around the Gavi Alliance to mobilize resources, to pull demand for vaccines together in order to ensure that more children and in the end every child has the access to these fantastic cost-effective life-saving tools that vaccines are. I'm happy to say that we've had a very productive board meeting here in Dar es Salaam the 2 last days. We can celebrate here tomorrow the launch of 2 new vaccines against pneumococcal and rotavirus here in Tanzania, and I commend and congratulate the Honourable Minister with this effort. It's a brave and very strong sign of political will, ambition, but also ability on behalf of Tanzania. And the good news is that since these 2 new vaccines were introduced and available for Gavi countries, we have, as of this week, seen the introduction of pneumococcal vaccine in 24 Gavi-eligible countries and the rotavirus vaccine in 12 countries the last couple of years. And we expect an all-time high next year, up to 18 introductions of pneumococcal vaccines in 2013, and up to 7 rotavirus introductions in countries next year, all depending on supply. But it's a fact that Gavi has never had a higher activity level. We have never had more children vaccinated. We have never had more vaccines in our program. We have never spent more money on vaccine on behalf of the whole Gavi Alliance than we do in 2012. So it's a very exciting time to come together at this Partners Forum. And just to give you a taste of what we have been discussing at the board, there is an exciting opportunity ahead of us of eradicating polio in the world. We know that smallpox was eradicated due to vaccines, and we now have a better situation than ever when it comes to polio. And the Gavi board has given our CEO and the Secretariat the green light to go on to find ways that we, through the Gavi mechanisms, through IFIM and through other mechanisms of Gavi, can support this polio plan, and especially as it goes on into routine immunization, which is a key focus of Gavi. So I'm looking forward to these days. Some of us have spent a few days on the road in the field seeing your honorable ministers, your good people working in villages and in health clinics and hospitals around the country. I can assure you that there's been some hard work done to prepare for this launch, and we are very excited to see that the children of Tanzania get this opportunity. We know it will save thousands of lives, as it will save millions of lives worldwide. Thank you very much.
Thank you very much. And Minister, would you say a few words as well? Thank you.
Yes, thank you very much. First of all, I'd like to thank Gavi for giving Tanzania this opportunity to host this meeting. And indeed, I would like to extend a very warm welcome to all the participants of the meeting. The partnership between Gavi and the government of Tanzania dates back since 2001. And during that time to date, we have received support to the tune of $110 million towards procurement of vaccines, about 87% of that, and immunization system strengthening, about 13% of that. And due to this support, we were able to increase our vaccination coverage in Tanzania to above 90%, which is very much commendable. But we are especially excited, and I'm delighted to announce that tomorrow we will be launching 2 new vaccines, the pneumococcal vaccine and the rotavirus vaccine. As you know, pneumonia and diarrhea are the second and third leading causes of deaths in children under 5 years of age in Tanzania. So with the launch of these vaccines, we are hoping that we will further decrease the mortality rates for under 5s, and thus lead to achieving the Millennium Development Goals. So once again, I would like to thank Gavi and other partners, both bilateral, multilateral, and others, for their support to Tanzania. Thank you.
Thank you. And Mrs. Michel, would you like to say a few words about your support of Gavi?
Well, thank you very much. Yeah. Thank you very much for this opportunity to join the Gavi family. After many years, I have been associated with this wonderful partnership, which has brought, first and foremost, countries themselves to take responsibility for the health and well-being of their children, but with support of the international community, and in particularly Gavi, building capacity and helping the ministries of health on the continent to improve the coverage and also the quality of immunization in our countries. But the motto for Gavi is every child, everywhere, which means we have made a huge progress from the time I joined Gavi like 12 years ago. So we have reduced the time where, for instance, a vaccine is available in developed countries and then it is available in a developing country. We have also reduced the time where the availability from the capital of the country to the most remote areas. Now we have improved also that distance. But I have to salute, actually. We fought together for finding, the pneumococcus and the rotavirus and even HPV, which is going to be available soon for some countries. And that is really a huge progress. But the reality is there are still millions of kids who are dying. They do not have access to immunization. So as we celebrate the successes we have achieved, we still have to work harder, particularly when the minister says we cover 90%. The 10% which is still left out is the most difficult to achieve, either because it's far away or it's because the communities which are scattered, or in some countries on this continent, it's children who are in conflict situations. So to achieve that small percentage which is left, it's much harder sometimes than achieving 80%. So we need really to improve much more the systems. We have to be much more creative in the way we reach the most remote communities. And more importantly, because we are talking to the media here, I think your contribution to mobilize communities. It will happen only every mother will take her child to the clinic and take the child for 3 doses which are necessary, because in some cases, even the basic vaccines today, mothers will go once and then go the second and the third doses. So we need you to help to educate and to mobilize. In many of our countries, we have even, community radios where local languages can take the message much to every family. And that's where we are. So we have a lot to celebrate. My support to Gavi is unconditional, because for me, it is a question of saying we need to keep every child alive. We need to keep every mother alive. And when we have not achieved that, we still have to work harder and harder and harder until we can say it's absolutely the best we can do. And those deaths will be in the normal life, because everywhere someone will die. But those unnecessary deaths have to be our responsibility to eliminate as soon as we can. But well done. And I think one important thing is that more and more, for instance, in Africa, more and more ministries of health are taking responsibility. They are putting money into it. They are building the systems. They are improving. But we still really have to get to that point we can say, every child, everywhere.
Thank you very much. What an inspiring message. Dr. Seth Berkley, the CEO of Gavi Alliance.
Thank you, and I'd like to add my words of welcome. And of course, when you have 3 great panelists before you, most things have been said. But I'm not going to talk about the amazing acceleration that's occurred in vaccines. I think you've heard about that. I'm going to touch on in a second some new vaccines or the health system's important work. Mm-hmm. But I want to focus on the last point you made, which is this is about supporting countries and making sure that over time they are sustainable. And so we have a lot of talk about Gavi where we discuss the money that's brought in from outside, and that's important. That's one of a 3-legged stool. The second leg of that stool is how we shape the markets for vaccines and over time reduce prices for those vaccines so that they will ultimately be affordable. And Gavi actually has been able to bring all of the markets together, and we now represent more than 50% of the world's birth cohort. That's what allows us to be able to do this, working with countries. The third part, which is critical, is having the countries contribute for every dose of vaccine. And I'm happy to report that last year, 100% of countries co-financed their vaccines. And this is important over time for them to be able to have their ministries of finance, their leaders engaged in this so that they ultimately will be able to sustain this because, like Graça said, this is about every child, everywhere, and it's about equity, which you've heard about. In terms of vaccines, 2 other points I'd just like to make briefly. We're celebrating, the world's celebrating this week the fact that the 100 millionth person has been vaccinated with meninge A. This is a vaccine that is being used to try to get rid of epidemic meningitis, which exists in a belt across Africa, and is a horrible disease. People get it, and the ones that live, some die, but the ones that live end up with terrible chronic disease. And this is an exciting new partnership because a group of partners came together, including the World Health Organization, PATH, the Gates Foundation, the Serum Institute of India, and they were able to make a vaccine for 50 cents a dose, which was a huge difference. And so we're really in a very exciting place with that. Second thing I'd like to talk about is the fact that Gavi is now moving forward with measles rubella vaccine. And measles is a disease you all know. Rubella is a disease that leads to congenital defects in women who are and we're going to be purchasing over 500 million doses of MR over the next 4 years. And I'm delighted to say that the Serum Institute of India is announcing today that it's offered to provide an additional 20 million doses for free as part of that, which will bring down the price and save Gavi $11 million. So the Serum Institute of India's director, Suresh Jadhav, is sitting in the front here. He'll be happy to answer questions later. So just to end and reinforce, we're delighted to be here in Tanzania. The accomplishment of 90, 92%, those numbers, is fabulous. And what they said, is the problem with that is we still have to reach that last 10%. And we're with you. We look forward to working on the new vaccine rollouts that are occurring in the future.
Okay, thank you very much. So we have time for some questions. If anyone would like to ask a question, if you could just identify yourself and your organization, it will help us frame the answers, and it may be that we can ask more than one panelist to answer your question.
Sarah Bosley from The Guardian newspaper. I was just wondering actually about the polio vaccine. That's the first I've heard of Gavi getting involved in that particular effort. Can you tell us any more about that?
I can start, and Dr. Berkeley can follow up. We're in the situation where polio has been eradicated in almost every country around the world. It's currently 4 countries where there is a problem, and we have decided today that we want to join the good forces now working to eradicate polio from the face of the earth through the mechanisms and the frameworks that is known to Gavi. That might be the IFIM, the International Finance Facility for Immunization. That might be other ways that we will now explore further. We see that the fight against polio more and more will be a question of routine immunization, which is also a very key focus for Gavi. So we see that in this phase we want to be a part of this fight to eradicate, but also to strengthen the routine immunization.
Thank you. I think Flavia Bostrea would like to say a few words.
You may know that the World Health Assembly this year will declare polio eradication a global public health emergency. So what you see now is the response by all the actors that are working in the sphere of immunization to actually achieve that goal, because we believe that our overall credibility is at stake. Now, a critical element of this is, until now, the fight against polio has been conducted through oral vaccine, we call it OPV. Now we have reached a point where our scientific group of experts have recommended that we switch over the next few years to an intramuscular vaccine that is called IPV. And it makes perfect sense that that vaccine is integrated into the routine immunization, and hence the discussion we had today with the Gavi partners, of which World Health Organization is a proud partner, to see what can we do together to accelerate that.
Add anything?
Sure, just while people are thinking of other questions. The critical point, Sarah, is that as part of the actual eradication effort, the higher the routine coverage is, the less unvaccinated children, then the supplemental campaigns try to mop up and reach those kids. If you don't have strong routine immunization, it is very difficult both to finish the eradication, but also we have to keep high coverage levels up post-eradication to make sure there's not a reintroduction. So this is really about supplementing the work they're doing. We're not going in, the polio eradication effort is doing a great job, and they're doing that work. Our job is to work with countries to strengthen their routine systems, and as Flavia has said, if there is a decision to move forward with IPV, the board is going to discuss this as part of our new vaccines next year, then we would be part of rolling that out on a routine basis.
Thank you. And René Carcenti, the chair of the International Finance Facility for Immunization, is here as well, if anyone has questions about that. Any other questions from the media? Sir, please identify yourself.
Yes, my name is Zidane Semberi. I work with the African newspaper in Tanzania. Most women in the Lulu area, especially in our country, have the mentality that vaccination normally is meant to control birth. It's birth control. It's blood that the Europeans and Americans, they are using that in order to control, birth, population growth. Do you have any comment on that? And also, I would like to ask my minister, how far have you gone as far as vaccination is concerned? In those days, in the 70s, people were saying vaccination in those days were very, more important concerning compared to what is happening right now. And also, I want some comments on that. Thank you.
Well, thank you very much. As I have said before, that our immunization program is very successful. Reaching coverage of above 90% is quite good. But as it was said before, that we need to reach the remaining percentage of children. But the fact that we were able to reach above 90% means the notion that vaccination is for birth control is no longer there. That used to be there in the past. But thanks to a lot of advocacy that has been done around this area, and I want to thank the president of Tanzania, who has been very instrumental in making sure that the message reaches everybody. We've done very well, and I believe that is no longer a problem. The problem now, the remaining few children that are not vaccinated now, is the fact that reaching them is quite difficult. Some of them have this nomadic life. They are moving from one place to the other. So we need to find solutions to that, find some different ways of reaching everybody. And that's the aim of the government. So we are hoping we'll reach them as well.
Thank you. Gita Raghav.
I just wanted to add, UNICEF is also a proud partner of the Gavi Alliance, and our role in the Gavi Alliance is, in fact, to mobilize communities, to educate mothers about the value of vaccines. It is the surest way to protect a child's life and to reduce child mortality. And as we saw from the film, a very powerful film that was screened at the board meeting this morning on Tanzania's program, mothers talk about the value of vaccines for their children and stand in line and wait many hours to get their children immunized. So I think increasingly, because of the social mobilization efforts, because of the community education, the demand for vaccines among mothers has increased.
If I may take it back to the gentleman who asked, because he's a media person, this country has one language which communicates with everybody, which is a huge advantage if you compare with other African countries. This country also has very high rates of literacy. And because you are journalists also, that is very important. And again, this country has, even in terms of community radios, et cetera, they are quite spread. I would take it back to you as a citizen of this country to say, yes, the government has to do this, yes, UNICEF has to do this, but what is the role of the media? To clarify those kind of misconceptions, which still exist in smaller percentages, the minister has just indicated. But it's the role of the media also to educate our people, to take the message across repeatedly and tell them again and again the advantage of immunization, and even to fight those misconceptions and rumors and sort of misinformation. It's not even misconception. It's misinformation because somebody said that and the community picked it up. So I just want to insist that the media has a very, very, very important role, and please take part on this. Become really a partner in these programs.
Key point. Kristen.
I'm Christine Pillitzer with DPA, the German press agency. Could you tell us a little bit more about the rollout of those 2 new vaccines that are going to be launched, when people will actually be able to access them in Tanzania, and then how long?
Well, first and foremost, because it's children involved and women. But second, because it's really a beautiful alliance. It's a beautiful experience, of a global experience, which I think it should be replicated.
Thank you very much. I'm afraid we have to go.
Well, first and foremost, because it's children involved and women. But second, because it's really a beautiful alliance. It's a beautiful experience, of a global experience, which I think it should be replicated.
Thank you very much. I'm afraid we have to go.